Now, as hospitals begin testing for the coronavirus, we're now looking to get some more answers about what to look for and whether and when you should consider getting tested. Joining me now is Dr. Stephanie Wright from the infectious disease. She studies infectious diseases at Hartford Hospital. Dr. Wright, thank you so much for being with us.
Thank you for having me.
I'm hoping you can give us some clarity about how they select who should be quarantined. For example, in Stratford, a family told us that their child goes to the same school as the coronavirus patient, and that family says only their daughter has to be quarantined, but no one else in that immediate family. So people are wondering, why isn't everyone under self-quarantine, or how do you draw the lines?
Sure. So the person who is at risk for getting the COVID-19 is the person who's been exposed by close direct contact. It's a matter of the level of risk, and if you have had close direct contact within 6 feet, especially if it's been prolonged contact, you're going to be the one at risk. So if the child was in contact with the person diagnosed with the COVID-19 when that person was symptomatic, the child has had the exposure and would be on the quarantine, but the family members who have not had contact with the person with COVID-19 would not need to be on quarantine.
Unless, of course, that child then comes back positive, and then it would spread to the family, I guess.
It could spread to the family. Again, in quarantine, you're taking measures to give yourself some distance from people, not the same amount of actions that would be taken if you were on isolation because you have the disease, okay, but you're still trying to limit contact.
So if someone is a smoker and gets COVID-19, are they more likely to have a serious case of the illness?
They are more likely to have a serious case if they have underlying illness. So if they have asthma or they have emphysema or COPD linked to their smoking, they would be at a somewhat higher risk to get a more serious disease with COVID-19.
All right, Dr. Stephanie Wright, thank you so much for being with us. That is all the time we have for now, but I want to let our viewers know we're going to stay in contact and we're going to continue to answer people's questions because I know there are so many questions out there. Thank you so much for being with us for Eyewitness News at noon.
Thank you.
I want to let you know we also have it on our website. Hartford Healthcare does have a hotline number. If you have questions, you can call and you can actually speak to infectious disease doctors on the phone. Be sure to stay with Channel 3 today for continuing coverage. We'll have more in just a few moments. We'll be right back.